everybody. Welcome to Meddkit's Provider Spotlight, where every week we get to interview the most amazing private practices from all over the United States. And, every week we come here and we get new perspectives. We get to interview not only amazing providers, but we the perspectives are so important to understanding, what is going on in healthcare right now, what is available to you in the United States in healthcare. And so today we have a really awesome special guest, Dr. Ashley Thompson. She is the owner of New Beginnings Chiropractic. So Dr. Ashley, welcome to Provider Spotlight.
Thanks for having me.
Yeah, I'm super excited to dive in. I know we have a lot to cover today, but something that I typically really like to, get off right off the bat is, your story. I feel like everyone has a unique story. You might want to tell us your why, what inspired you to open up your own practice. So would love to hear that from you first.
Sure. Growing up, I was really active in sports. I played basketball, I played softball, I played sports year round. And in middle school, I started having some pretty intense back pain. And our family was pretty traditional when it came to healthcare, but my dad decided to try chiropractic to get me some relief. I was the first person in my family to ever go to a chiropractor. And honestly, the first office we went to, we didn't have the best experience and we almost wrote the profession off, but my dad decided to take me to one more office and it was ran by a great doc and we had a great experience and it was totally life-changing for me. And I was back on the basketball court in no time. And then several years down the road, I was actually a sophomore in high school. I started having really debilitating headaches. I literally had a headache that lasted for 3 months straight. And for some reason, probably because we didn't know everything that chiropractic care could help with, we went the mainstream medical route. I even had a CAT scan. They thought I might have a brain tumor, and they'd give me medicine and it would help numb the pain, but I still had headaches. And so after months of doing that, the traditional mainstream medicine, we decided to go back to the chiropractor. And guess what? I didn't have any more headaches. So this really solidified at the age of 16 for me that chiropractic was what I wanted to do with my life. When I got to chiropractic school, I learned that you could specialize in the care of pregnant women and kids. And I knew that I was going to be a mom someday. And I wanted to make sure that I could take the best care of myself when I got to that point in time. So I decided to specialize and I just absolutely love it. My journey to opening my own practice really started during my childhood. Growing up, both my parents worked in corporate America. My mom liked her job. My dad didn't like his so much. And, he was a manager and especially hated the constraints that were placed on him by corporate on how he managed his people and did things. So I was constantly told while I was growing up, you don't want to work in corporate America. You want to work for yourself. You want to own your own business.
Awesome.
Um, yeah. Yeah,
So,
so I mean, I remember probably 9 or 10 him telling me this. So
wow.
um, when, right out of school, I worked for several offices, kind of learned the ropes. I also worked for chiropractic offices when I was in colleges. So I actually had a lot of experience working in different offices. And when my youngest child was 2 years old, my husband was like, it's time for you to open your own practice. So opening my own practice has allowed me to practice the way I want, work with my ideal client, build the environment that I always envisioned. And, working in numerous offices over the years really allowed me to experience and pick and choose what I liked and didn't like to cultivate my ideal practice.
That is awesome. One, I mean, I love your story because I think you can genuinely understand where a patient is at. You've experienced, maybe a similar kind of pain or just not knowing what's going on with your body. And, getting that relief feels amazing, but also to have someone that listens to you. And it's also great that you have such great mentors and parents that, opening up your own business is, a little risky at times. And,
It is.
I think a lot of, parents these days, take the safe path, like the path of like least resistance, because they want their child to be successful, but also they're scared of the risk. And I think that was so awesome that your parents were like, yeah, do this the way you want to, do this what, feels good in your heart. Practice the way that you need to so that you are successful and your clients are successful. And I think that's a really great lesson. And I wish maybe more people were told as youngsters that there's other and different opportunities out there and starting, whether it's your own practice or your own business. So that was very cool.
Yes.
Awesome. But would love to hear, in terms of your practice, I would love to hear about, the actual population that you serve. Like I know that you are, helping moms, moms to be, all stages of pregnancy, pre-pregnancy, post-pregnancy. So, and also pediatrics. So you kind of see an entire life cycle of
Yes, we do.
so would love to hear what that's like and at each stage, how it might be different.
Okay. Yeah, we love working with whole families. I love getting to meet the whole family. I've been in practice almost 20 years, and so I think um, here this next year, this next school year, I am going to have some of my first practice kids graduating high school, which is very, very awesome. Kids that I started treating very early in practice, and I've got to watch them grow up through their whole high school career. So, our motto at our office is we help families thrive and not just survive. We love treating the whole family. I am the only one in Wichita certified in the pre and postnatal and pediatric care. So we serve a lot of that population. We serve women through every stage of their motherhood journey, from those trying to conceive all the way through pregnancy, postpartum recovery, and beyond. For our moms to be, we're Webster certified. I've got another doctor in my office, and she is also Webster certified, which is just the specific specialized training that helps support optimal pelvic alignment during pregnancy. So, what this really means for our patients is more comfort during those 9 months of pregnancy, less back pain, reduced sciatic pain, better sleep. But beyond comfort, proper alignment can actually help you have a better birth by providing good space for baby and helping baby be in a good position. So we've had so many moms tell us that their labor was easier and shorter after regular chiropractic care, whereas with previous pregnancies, they hadn't done chiropractic care and they had a really rough birth. On the pediatric side of things, this is where we get to see some really beautiful things. Babies can experience tension from the birth process. Even gentle births are kind of hard on mom and baby. So tension in babies can show up as colic, reflux, difficulty with latching for breastfeeding, sleep problems. So our approach is really, really gentle. We use about the pressure it takes to dimple the skin of a tomato, but the results can be really amazing. Parents, come in exhausted because baby's been crying for hours and hours, and after a few adjustments, they'll say their little one's sleeping better, pooping better, eating better, and just overall happy, more content. What I love most is that, we aren't just treating symptoms. Most people think of chiropractic, headaches, neck pain, back pain, that type of thing, but we're treating the whole family through their wellness journey. So when baby feels better, mom feels better, and the family thrives.
I love that perspective. Most oftentimes, yes, you think about treating symptoms and getting better, but then also there is this like snowball effect in a positive way now that, baby feels better, like you said, that mom feels better, family feels better, and it just radiates throughout that entire family unit. And you don't realize that one life change can actually mean many lives changed in the process. So that is very, very cool. Would love to hear a little bit more in depth about your approach and protocol and how, that is different and unique as well.
What probably really sets our office apart is just our comprehensive family-centered approach. That goes just beyond the adjustment itself. All of our patients are like family. We get to know you, we get to know your family, we know what's going on in your life. Um, like I mentioned earlier, we're both Webster certified through the International Chiropractic Pediatric Association. We both have extensive training in pre, postnatal, and pediatric care, and most chiropractic offices don't offer that. We made this our specialty because both of us are moms and we're passionate about serving families. Um, we don't just adjust and send you on our way in our office. We take the time to educate and empower you. When we're working with tongue-tied baby cases, we're collaborating with pediatric dentists, your lactation consultants. We're making sure that you have the appropriate care before and after the procedure so that we can make sure baby's body is functioning just as well as it possibly can. when you come into our office, our assessment process is really thorough. We're looking at the whole picture. If we're treating a baby, we're also making sure we know how mom feels, how it's affecting the family, so that we really get a good deep dive into what's going on and what we can do specifically to help. Um, Honestly, I think probably the best thing, what people like most is that we treat you like family, and our patients are family to us. We absolutely love coming to work every day and love getting to know everybody.
Yeah, it's something that I was thinking about as you were telling me this is, obviously, birth is trauma on the body, for sure. And it's insane that in modern healthcare, we do like one post-op visit for mom, to make sure she's okay.
Yes.
Body and mind. And, it's great that, not only are you working with the entire family, but something that just clicked that you said, we're also making sure mom is okay during this. And so I think that is so important as mom doesn't get a lot of care afterwards, you
They
know?
don't, and it's totally different in Europe. Europe does things way better than the American postpartum healthcare system. And so, OB's job is to get baby here alive and keep mom alive. And then they kind of wash their hands. And,
Yep.
we don't do any pelvic floor rehab, and that's standard of care in Europe. So it's just, we could do better. We could do better in our country. And so we
Yeah.
try and bridge that gap between mainstream medicine and all the other, and just really collaborate with other providers so that our patients are getting the care that they need.
Yeah, in the vein of education, a question that I absolutely adore and love because I think especially in your field and working in pediatrics, but also with moms and pregnancy, there's like 1,000 wives' tales, right? Like throughout this entire process. And so that being said, I think no specialist is um, caught off guard by some of these maybe misconceptions, old wives' tales, but nonetheless, they're still out there and still being circulated all the time. And the
Yes.
internet may not have really caught up as well. And so you're sitting there Googling, ChatGPTing, this is my symptoms. What do I have? They say cancer. I'm scared. What happens? So, in the realm of all that, what are some of the things that you would just absolutely love to debunk and be like, we hear this all the time. It's so not true. Or this is what you should actually be doing, so on and so forth.
That's a really great question. So probably the biggest one I hear in our office is that chiropractic isn't safe for babies and pregnant women.
Mm.
People think that we're going to crack a baby's back like you would an adult, and that absolutely terrifies patients. We even have some people that come in and say that that's what their pediatrician says we're going to do, and that's just pure lack of education. The reality is pediatric chiropractic is completely different. We use the same pressure you'd use to check to see if a tomato is ripe. It's incredibly gentle. Often babies will sleep right after adjustment, or pooping and sleeping well are two of the biggest side effects of getting adjusted. Um, there's a lot of YouTube and TikTok videos out there that people are getting the wrong idea on. Another misconception is, um, you know, why would my baby need chiropractic care? There's nothing wrong with my baby. But when you think about a baby wadded up inside your stomach for months on end, if you sat in the same position for one full day, would you be stiff and sore? Yes. And then you have the birth process, even if it goes 100% fantastically perfect, it's hard on you, it's hard on mom. So baby can have tension patterns from being in the womb. And again, chiropractic, we're not treating disease, we're optimizing their little nervous system so that they can function at their best. So yeah, baby may not cry all the time, but they may just kind of lay one way. They may be happy, but they may kind of favor their head one way. And so that's one of the biggest misconceptions is, my healthy baby wouldn't need it. Another one is once you start going to the chiropractor, you're going to have to go forever. And that's not true, but a lot of people feel the benefits of chiropractic and know how good they feel being adjusted. So they choose to do maintenance care and just, do periodic adjustments throughout the year. But our goal as your chiropractor is to get you functioning well. But a lot of us want to keep supporting you that way, just like, you go to the dentist every 6 months because you want to be preventative on catching cavities early, stuff like that. So the same thing goes for chiropractic care. So yes, we don't wave a magic wand at you and make you come back for the rest of your life, but a lot of people do see the value in it. But we're here to support your family's natural ability to heal and thrive and not replace your medical team, but be an important part of it.
Yeah, absolutely. A lot of that, kind of makes me chuckle in a way. And I see where people come off, I think, TikTok, YouTube, social media in general, really sensationalizes what happens,
Hmm.
in a healthcare setting, whether it's you're in chiropractic, you're in dermatology, you see these before and afters, and it's, everything is Amazon 2-day shipping, results immediately, and so health is a journey.
It
See
is.
the right people, be proactive about your health. Don't let, the rock come through your window and wait till you like are crippled and like really have to go see someone. I really like what you're saying, especially about, newborns, is that yeah, you've been stuck inside this womb for a long time. Don't you think you might need to like stretch out a little bit and
Just a
get a
little
little bit more comfortable
bit.
in this new world? Yes, that makes a ton of, you're like the first person to say it that way. It makes a ton of anyone with a brain, it makes sense, right? That
Yep.
get it. So I think we can all jump on that bandwagon pretty quick. Um, but this is extremely helpful. In the vein of all your amazing advice and debunking some misconceptions, is there, you know, obviously you must give some parents some tips or athletes some tips that, they can do at home or things that can even move their health trajectory in a better pattern going forward today. So, I would love to know what maybe that is, or maybe something that you wish that families knew about getting care and what would help them out significantly in their journey.
Okay. Um, so for our pregnant moms, big piece of advice is don't wait until you're in pain to start care. I wish every pregnant woman knew that starting chiropractic care early in pregnancy, even in the first trimester, sets you up for a much more comfortable 9 months. Your body's going to change dramatically, and we can help support those changes from the beginning, rather than trying to play catch up later when you're uncomfortable. Same thing with kids, starting care early helps prevent chronic issues as adults. Statistically, children have 2,000 spinal traumas by the time they're the age of 2. And that sounds like a lot, but when you have, a toddler that's getting ready to walk, how many times a day are they falling? The great thing about kids is they're resilient and they bounce right back. The bad thing about kids is they're resilient. We don't necessarily know that there's issues that are going to sit in there uncorrected for years and years and years and then turn into a chronic problem in their, when they're adults in their 20s, 30s, 40s. Um, One of the most common homework assignments we give for new parents is tummy time. We teach parents how to correctly and consistently do it. Very important for developmental issues. They can be prevented with proper tummy time from day one. And a lot of education lacking from the pediatrician, I find a lot of times. Parents come in and they've got a 3-month-old and they're doing maybe 10 minutes of tummy time a day. And you're like, whoa, how's this baby ever going to learn to roll over if this baby's never getting any tummy time? So that's probably the biggest homework assignment we give. And then depending on what's going on pregnancy wise, different stretches, different yoga moves, all of that. For feeding issues, whether it's breastfeeding or bottle feeding, making sure that you're working with a really great lactation consultant, because chiropractic care combined with good lactation support makes all the difference. And in Wichita, we've got some fabulous lactation consultants in our area. So again, our office is huge on collaborative care and making sure that you're hooked up with the right provider. Um, and then, for anybody else, any families that are considering care that don't know what, or maybe unsure, I'd always tell them, just, come in for a consultation and let's do an assessment and see what's going on, and see if we can help your body function better and, help your family thrive and not just survive.
I love it. I think, thank you, Dr. Ashley. I think this is great advice, especially for first time, parents that are this is their first time that they're just trying to figure it out. And even for moms that maybe have other children, but maybe obviously all children are unique and they all are different in maybe that newborn phase. And they're kind of questioning, okay, what do I do? I haven't seen this before. My other child was not like this. And what do I do? And so I think you've given such great answers and maybe just a little bit of calm to what is an exciting but also can be a little bit of a stressful time when you're just not quite sure, what to do in some of these situations. So I thank you for your A+ advice and pro tips for all the families out there and to be families out there. And before we leave off, Dr. Ashley, if you can just tell us, where folks can reach out to you, get more information, that would be fantastic.
On Instagram, we're New Beginnings Wichita, and Facebook, it's Dr. Ashley Thompson. And then you can always just send me an email at drashleyt@yahoo.com.
Awesome. Well, thank you so much, Dr. Ashley. We really enjoyed having you and hope to have you on again.
Yeah, thanks, Rachel.